name's Seth Walker. I'm one of the pulmonary critical care physicians at Piedmont Atlanta Hospital, and I'm the director of the Bronchiectasis clinic. Bronchiectasis is a condition where the airways have become larger than they should be, and that leads to an inability to clear mucus effectively from the airways. When the mucus can't be cleared easily, then that becomes a great place for bacteria to grow. When the bacteria are growing, they can cause a chronic infection or recurrent infections. That leads to damage to the airways as well as inflammation from the immune system coming in trying to kill the bacteria. Most commonly in bronchiectasis, the biggest symptom is cough, and people can have intermittent cough or a chronic cough. Oftentimes it's productive of discolored sputum. But people can also have shortness of breath. They can have recurrent bronchitis or pneumonias. They can notice wheezing or tightness in their chest as well. There can be many different causes of bronchiectasis. One of the ones that people may be most familiar with is cystic fibrosis. So cystic fibrosis patients, their lung disease is bronchiectasis. Bronchiectasis is really diagnosed by the clinical picture in combination with a special type of CAT scan called a high-resolution chest CT. Bronchiectasis is not curable, unfortunately. When there's damage to the lungs, we do not yet have the technology to be able to reverse that. Certainly there are treatments where we can improve symptoms, improve quality of life, keep people from getting sick, having flare-ups as often. Treatment options for bronchiectasis involve trying to break that cycle that we were talking about. So trying to improve airway clearance, and that can be done with a nebulized sodium chloride, a highly concentrated salt solution that loosens up mucus, makes it easier to bring up. There's also mechanical techniques that can work on creating vibrations within the airways that helps loosen the mucus off the airway walls and easier to bring up. There are medicines like azithromycin, which was originally developed as an antibiotic, but has an anti-inflammatory property in the airways. And so patients that take azithromycin regularly notice less flare-ups and oftentimes an improvement in symptoms. The small amount of therapeutics that we have currently, we can make a big difference in people's lives when they have bronchiectasis, but I'm very excited about what the future holds with being able to have a larger armamentarium and more options for people that may have contraindications to one medicine or haven't been able to tolerate it in the past. I've certainly seen patients who had been sick repeatedly, giving them the proper diagnosis, giving them a treatment that breaks that cycle for them and that allows them to feel better on a day-to-day, to not be in the hospital as frequently, is an incredible feeling.